Good morning. Welcome to the second session in a series of workplace representative educational sessions, RN Specialty Practices Update. My name is Yvonne Harris. I am one of the practice advisors for the SRNA. I also serve as the liaison for the workplace representatives and the SRNA. I would like to begin today's session by acknowledging that we are all on treaty land, regardless of where we sit. In Regina, we are on Treaty 4 territory and the homeland of the Métis. We thank those who have taken care of this land and share it with us today. We are all treaty people. So thank you everyone for being here today. Before we get started, I would like to start with some general information items. We will be monitoring the chat section for any questions that come up during the session. If you do have a question, please type it into the engagement box and we will forward it to Barb. There is time at the end of the session for questions. If we can't answer your questions during that session, we will make sure that we follow up with you offline. The session is designed to be 30 minutes in length, and it is being recorded for later viewing. Okay, so getting started. In today's session, SRNA Practice Advisor Barb MacDonald will discuss SRNA's Registered Nurse Specialty Practices Guideline. The purpose of this guideline is to provide direction for registered nursing practice with an Rnsp model and to support practice that is consistent with the current SRNA registered nurse practice standards, registered nurse entry-level competencies, and the Canadian Nurses Association Code of Ethics for Registered Nurses. Barb is a subject matter in RN specialty practice, and her expertise has been instrumental in the development of this guideline. I am so happy that she is here with us today. So over to you, Barb.
Thank you, Yvonne, for your kind comments. And thank you everyone for joining today. It's really nice to be able to meet with you virtually. I see the numbers climbing in the participant box, so we're going to have a lovely 30 minutes ahead of us. So thank you for taking the time out of your work to join us to talk about something that's very dear to my heart, which is RN specialty practices. So the first thing I'll do is share my screen and we'll work through a presentation, and then there will be time for questions and answers through the chat box as Yvonne has mentioned. So I'll share my screen, sound is on, and PowerPoint. So I'll need a confirmation, probably verbally, Yvonne, to let me know you can see the slides. And we're ready to roll?
Yes, I can see the slides.
Okay, thank you. All right, so let's talk about the RN Specialty Practices Guideline. You can see it pictured here on the right. It's a new cover and an update that was effective June 11th, 2020. So our new guidelines, and this model applies to RNs who are licensed to practice in Saskatchewan, and it optimizes the RN practice in the interest of the public. With the RN Specialty Practices Guideline, we have a few objectives for this session. Number one is that we want to inform you about the new guideline and that it builds on the original RNSP model, that we want to highlight some key points about it. We want to inspire people to access the guideline and to think about how it relates to practice, as well as exploring how, this is a starting point, exploring how the workplace representatives can be involved. So to begin with, let's think about the context for RN specialty practices. So everything that we do as registered nurses within Saskatchewan is within the RN Act 1988. And within the Act, for context here, is about registered nursing practice. So we have the RN category and we have an NP category. So those are the two categories that we have at the SRNA for practicing in Saskatchewan under the RN Act 1988. We have then also the academic preparation that occurs in the schools, and then we have entry-level competencies. So in that zone, really essentially they've written the exam, they've become registered nurses, and there's an entry to practice component that is not defined by time, but is relative to the practice area that the registered nurse is entering into practice into, and then that development of practice beyond entry level. Likewise, for RNs who become NPs, there's academic preparation, and then the entry-level competencies for NPs, and then they're practicing also as NPs. And essentially, there are about 250 NPs, approximately, and there are roughly 11,000 plus registered nurses in Saskatchewan. It is really a novice to expert continuum that we're talking about across that continuum. Now, what we're talking about today is RN practice, and we have RN specialty practices that essentially apply to the 11,000 plus registered nurses in our province. Also within the RN category, we have RNs with additional authorized practice, which is a separate designation. And they are working primarily in the north, and we have approximately less than 120 RN AAPs licensed in Saskatchewan. And RN AAPs also use RN specialty practices. Within the RN AAP practice, they are adhering to clinical decision tools, 59 clinical decision tools for their ability to treat limited common medical disorders. So today, specifically talking about RN specialty practices. So this is a guideline, and I want to have just a word about what a guideline means with respect to our regulatory structure. So a guideline, often when we hear the word guideline, it gives some sort of flexibility, like I might or might not do it. But in the context of RN specialty practices and the RN SRNA, a guideline by definition is that which supports practice that's consistent with the standards, competencies, and code of ethics for registered nurses. And coming from the regulatory body holds weight behind it. It truly guides practice. So this definition comes from, and you're able to look this up online, we have a document definition under council policy, where we look at the different types of documents and their description and their authority. So in this case, a guideline, as I said, supports the application of the standards, competencies, and code of ethics and provides direction for registered nurse practice. The authority comes from SRNA Council. The consultation is that there's targeted and broad consultation with key stakeholders and members. So prior to this guideline being approved by council in June, there was all kinds of consultation, external, internal, before it ever reached the point of approval. So council approval came, and essentially the notes are that guidelines support the professional practice of the SRNA members. Now, there is also competency with respect to the individual registered nurse, and prior to implementing any RNSP, it is essential to assess the available resources to ensure they align with providing safe, competent, and ethical nursing care, consistent with the standards, competencies, and code of ethics. And the environment must support RNs to meet their professional and ethical obligations. If the appropriate resources are absent, RNs must carefully consider client safety when deciding if they proceed with performing the RNSP, as well as advocate for immediate availability of access to the required resources. There is responsibility then within our own competencies to ensure that our RN specialty practices adhere to our individual competencies and the competencies, standards, competencies, and code of ethics of our regulatory body. So what I've put together is a bit of a highlight sheet and an audio file for you to listen to that goes through some of the key things and hopefully is inspiring you to think about accessing the guideline and thinking about how it applies to your practice. So I'll play the audio recording. It's 2 minutes in length, and then we'll go further into the presentation. Here you go. There is a new RN Specialty Practices Guideline that we are very excited about. The guideline refines the original RN Specialty Practices model and holds enormous potential for RNs to safely and competently optimize their scope of practice in the interests of individual clients and client populations. RN Specialty Practices apply to RNs who are licensed to practice in Saskatchewan, of which there are over 11,000. There is no additional designation beyond RN for those who engage in RN specialty practices. RN specialty practices are centered on the needs of the client in their surrounding environment. They provide the opportunity for RNs to manage client populations, which are people with similar health needs and circumstances. For example, RNs monitor blood clotting levels and adjust doses of warfarin for this specific client population in home care and clinic settings. Picture it, clients at the center of the model and RNs practicing to full scope to meet their needs in every practice setting in the province, from emergency rooms, whether rural or urban, to correctional centers, sexual health clinics, long-term care settings, remote and isolated communities, and more. RN specialty practices are brought to life through RN clinical protocols, which are created collaboratively by employers and point-of-care RNs who are experts in their fields. Interprofessional communication, collaboration, and coordination are essential. RNs are as ubiquitous as the people who need our care. Let's use RN specialty practices to connect the dots in a straighter line between RNs and the clients in Saskatchewan who need our care. Access the new RN Specialty Practices Guideline. Think about how it applies to you and take action to bring it to life. Okay, so moving then into the guideline itself, there are four essential component categories essentially within RN clinical protocols. In the RN Specialty Practices model, we've really focused on where will the authority come from. So you'll see here, the RN clinical protocols is focused on, is it for a specific client or is it for a client population? So this is under the authority piece, but keeping in mind, is it client specific or is it population specific? So let's have a look at the four components then. The essential components are, it has to be, absolutely has to be in the interest of the client in that particular environment. Number two, there needs to be evidence to support that practice. Number three, what is the authorizing mechanism? As I mentioned already, is it going to be client specific or for a client population? And number four, what are the competencies for the RN who will engage in this RNSP, and they need to be clearly defined. So I'll take you into the document itself. It's posted on our website, and look for Rnsp Guidelines 2020. And here's what it looks like. It's not a very long document, as it turns out. It's about 9 pages in total. The background information, I think, is really important to think about context and a little bit of the history. And what I'll take you into is the clinical protocols and the four pieces. So there's the model that I just showed you. And here are the essential components. So with the client at the center and the environment, this can't be emphasized enough. It has to be the right thing for the client in that particular environment. So given that the employer is creating the RN clinical protocols together with the point of care registered nurses who are the experts in the field, there has to be a consideration for sure about what is happening and what is in the interest of the client in that particular environment. That's why we put it number one on the list, always keeping the client at the center. Number two is essentially the evidence for the practice. Now, evidence includes, of course, peer-reviewed evidence and how to do the particular procedure, including the nursing process with respect to assessment plan, implementation, evaluation. But it also considers things like, what does legislation say about this practice? Is there a particular legal requirement around the practice? And also, for sure, measuring risk. What is the risk and what will be done to mitigate the risk? The risk-benefit ratio is incredibly important. Cultural safety, competency, all of the things that form the decision-making and supports that practice and the decision to go ahead with creating an RN clinical protocol for that particular practice. The third part we're calling now authorizing mechanisms. So under the authorizing mechanism, either it will be a client-specific order, which includes an order set. When you think about having one person's name on the top of whatever that form is, that means it's client-specific. So it can be a patient order set, but it is client-specific. And in the client population part of it, it's called a directive. And this directive is a written order. It has to be thought about in advance for a client population. And it can be authorized by a physician or an NP. So the population that you're talking about needs to be described in the RN clinical protocol. And one thing I haven't mentioned is that the employer also needs to have an overarching RN Specialty Practices policy saying, yes, in our organization, we will have RN Specialty Practices that adhere to the RN Specialty Practice Guideline. And the fourth thing is the competency requirements. So what does the registered nurse need for this practice, both at outset and ongoing? And how will that be maintained? How will it be defined? And that's clearly related also to the evidence, number two, in terms of what kind of evidence is there to support that, first of all, registered nurses do this practice, and then what kind of competency is required. It may or may not include specific education requirements or courses. So the employer defines that together with the registered nurses who are experts in the field. And there is a checklist, Appendix A, that goes through each of these things so you can think about, so what is the title? Who's approving the RNSP? So the employer approves the RNSP, which is different than the authorization, which is number three, the authorizing mechanism. Okay, so the employer approves and keeps the RN clinical protocols updated. And there's an effective date and review date. And that will be determined on what practice it is and how frequently it needs to be assessed based on that practice. And then, so the authorizing mechanism, is it a client-specific order or is it a directive? It's an evidence-informed approach, so these things are considered, and of course on this checklist there are blanks because there may be other evidence factors that come into play with respect to that particular RNSP. And then in terms of the competency, which RNs in which practice environment are approved to perform this RNSP, and what are the competency requirements that are listed. So this is not meant to be it's only 2 boxes. This is meant to be a checklist that can be adapted and utilized if you wish as employers to create RN clinical protocols, or really essentially to continue them, because RN specialty practices have been in place since 2014 in Saskatchewan. So that's a look at the new document. I really encourage you to go in and have a look at it, to become familiar and really think about the possibility for your own practice. So let's move along then. And in summary, and I honestly don't know how much time has passed, but I do want to leave lots of time for questions and answers in the chat box. But in summary, RNSPs place the center of the client of the model, pardon me, and they recognize the RN at point of care as expert. The RN clinical protocols are created collaboratively by the employers and the RNs and are designed to meet the needs of the public. RN clinical protocols need to include all the essential components for the specific RNSP and need to be in place prior to their implementation. The employer determines the frequency for review, updating, and approval of the RNSP with consideration for advancements in practice based on evidence and best practice. And safe, timely quality client care is supported through optimization of RN scope of practice through the implementation of RNSPs in Saskatchewan. I'm sure that you have all kinds of questions because this is meant to be an overview and to really inspire you to go in and think about how we can move forward together. I know that you play a unique role as workplace representatives in terms of getting the word out and inspiring people also to think about their practice with a conduit or a connection with the SRNA. So I do want to explore with you the way forward in terms of how we can work together to share this exciting, what I think is a very exciting information about the practice environments. So I think that it would be good to think about your practice environment and the possibilities that exist, which would optimize nursing practice in the interest of the public. I know as a practice advisor at the SRNA over the last 5 years, I've had all kinds of opportunity to understand people's involvement in RN specialty practices, and they have certainly evolved over time, where truly registered nurses are meeting the needs of the client through optimization of their scope. And we do know that there's more work to be done. And you know, how do we implement this RN Specialty Practices Guideline in a way that optimizes that scope? So this is the time for Q&A, and I really do want to thank you for your attention. It's my style is typically very facilitative, and I like to be able to see you and see the nods in the crowd saying, yeah, this is exciting. At this point, I'm only assuming that you're just as excited as I am, and that we can find a way to interact. So I think in this format, we will use the chat box and answer some questions that way. So I'm going to stop sharing so I can see what the chat box is, what's happening in the chat box. And I see that it's 10:21, so that's about the right amount of time for having some questions. So can you think about, first of all, are there any questions around RN specialty practices that you can put forward in the chat box today? I don't know if you're seeing anything, so, Madeline or Yvonne as well.
Hi, Barb. So it is Yvonne, and I'm not seeing any questions right now, but I think our IT team is checking. There may be some technical glitches that are not allowing us. One of the questions that I would just sort of ask or just think, have you, and I'm not sure if we can sort of touch base, what are some common Rnsps that you think, are there sort of certain Rnsps that you think have, since we've got this new, since we have the new guidelines, some new Rnsps that have come out that you could maybe talk about or that maybe you've heard about as practice advisor?
Sure. Since the new RNSP guideline has launched, which was June, and in the middle of a pandemic, there hasn't been a lot of new ones coming up. But I think because this model, which was established in 2016, really the model hasn't changed. I should also emphasize that the model hasn't changed, but rather it's just refined to focus on the authorizing mechanism and to be clearer about the process steps to make an RN specialty practice come to life. I'd say even in the pandemic though, for example, one of the ones that came up was that to facilitate COVID-19 testing in the North, they already had a Gen expert lab process in place where the registered nurse was involved in generating different lab results. And it was really easy to add the COVID-19 testing to that Gen expert process in the North to facilitate that testing and analysis. And they worked really closely with provincial lab to get that into place and to get the training in place. Because they had a foundation of RN specialty practices already there, it really supported the addition and the prompt response to adding COVID-19 testing in the North as well for those who had that Gen expert lab capacity. Also, things like, you know, STARS, I've had conversations with them about their RN specialty practices and practicing to full scope. So many examples, same with corrections, just so many different practice areas where registered nurses are optimizing that full scope. one of the things we think about is where are the opportunities? Where are the circumstances where we stop and have to go get an order to authorize the care that we know already exists? So if we think about, is there a client population approach that we could have to that when we already know what the client needs based on evidence? Let's formalize that through an RN clinical protocol and work together to have a process that is standardized and effective across the province. So sharing where possible. And I think that collaboration is something that we could still build on as we move forward, for sure.
So I do have one question that is accompanied by a comment. The comment is, "Thank you, Barb, nice and clear. It is nice to see how this has progressed." And this person loves the checklist. Her question is, how do you see the RNSPs unfolding further in the future?
Oh, that's a really good question.
Yeah.
I think that RN Specialty Practices, the model that exists, provides the flexibility for that evolution of practice. So when things are evolving all the time in terms of evidence and best approaches and being nimble and being responsive, that foundation is there. So I think that provides that environment for that rapid response with an interprofessional collaborative approach. So then registered nurses fit into that collaborative approach. Those who are at point of care have that evidence and that expertise that is really, really critical. It's fundamental to the whole thing. So over time, it will expand potentially to include, who knows, but at this point, the registered nurse is able to provide medications and provide the diagnostic parameters like lab work and so on within the context of an RN specialty practice, RN clinical protocol already. So I think that the best thing right now is to actually optimize the potential within the model that exists right now, and to really clearly look at your practice and think about, you know, for example, in the ER, if someone's coming in, what can the RN facilitate under the RN's authority, like initiating an X-ray, getting some pain management underway, depending on what the disease state is, but following an algorithm. You know, in my discussion with SARS, which was last week, they have clinical protocols that are state of the art and are quite willing to share. So how can we work together across jurisdictions to make sure that best evidence is applied and that we have a seamless approach regardless of who the employer is? So, you know, that's where I see the future is really coming together to have that standardized optimal approach for registered nurse practice across the province.
Excellent. So very exciting. There was also another comment. Great job, Barb. No questions, just appreciation. But this is followed by a third person who has a question. As a direct care RN, what is my role in contributing to the creation of RNSPs?
Ah, very good.
Yes.
That's a great question, because throughout we have the point of care registered nurse as being fundamental in all of this. So I think that the most important thing to do right off the hop is to understand the model and to start to explore what you think is the possibility within your area, and start with one thing. Start with probably the most pressing thing or something that is manageable to gain that expertise. It's going to be about communication and about saying, here's what I think needs to happen. How can we make this work? So having truly a solutions-based approach, saying, this is what I see from my critical lens, my standards and competencies and code of ethics support my thinking around this as a registered nurse. And how can we work together to make this happen? And you might be the catalyst to bring a provincial group together, or you might be someone who's inspiring your manager and employer to say, how can we do this in a really cohesive kind of way? So I would not underestimate your potential wherever you are. And in fact, we need that potential to be able to work together and to make the best things happen. If we're waiting for someone, I guess, to figure speech from the top to do it all, we'll be waiting a long time, and that puts a lot of pressure on those who are not truly at the point of care. So I think everyone relies on your expertise to bring that forward and to truly shared and inspired that collaboration. So thinking about what is the best pathway given your employer and your current environment.
Thank you, Barb. So it is 10:30. I will check with the IT team. There is one more question that has come through.
Okay.
I think I'd like to take this extra minute of time for you to answer it. And the question is, it just disappeared. Oh, here we go. Is there an overall policy for RNSPs, given we are all one health authority? Do we have access to the ones that are SHA-wide?
That is a really good question, especially as we have that one large health authority, certainly not the only employer in the province, but a very important one, right? And regardless of where, the SHA intersects with every employer, right? Because we're all part of the province, we access the acute care services and so on. So we work really closely with the professional standards group, and every month or so we're coming together to say what sorts of things are you seeing, what are your challenges, and likewise working together with them to think about how RN specialty practices can be applied, as well as other things that are going on in the environment. I think the most important thing is to keep that dialogue open and to go explore what the possibilities are. I can't answer for the SHA, but I know that there is the spirit of collaboration that exists for sure, to get it right and to move forward so that we have an interprofessional approach in the environment that we're working in. So I would check with that professional standards group. You can connect with us and we can get that email address or the contact people to you if it's not familiar to you. But yeah, having that dialogue so that everything continues to move forward with an evidence-informed approach, and always the client at the center of the discussion. I think if there's ever sort of some confusion, I'm always coming back to say, well, okay, wait a minute, what's in the interest of the client? What's going to be the best thing for that person in that environment? And then let's rally around to see from our different perspectives how we can make that happen.
Thank you, Barb. That is absolutely true. The next comments is a thank you for your clarity in speaking, and you've brought forth this very important topic in such a way that helps us all understand and become excited about the potential that we have as registered nurses. So I would like to thank you for an excellent presentation. It's been an exciting 30 minutes for me, but for registered nursing in Saskatchewan. You helped us envision a stronger, more powerful power of nursing, and I think I look forward to that. If there are questions, as you go back into your workplaces, if you do think of questions, please feel free to contact us, because as Barb said, this is very exciting, and we want to make sure we get this message out to everyone as quickly and as effectively as possible. So thank you so much.
Thank you, Yvonne.
All right.
Good luck with everyone.
Good luck to everyone. Take care. Stay safe.